Hello, I'm Dr. Manu Mahajan and today I'll be talking about the macrovascular complications of diabetes. This video is aimed at anyone who wants to have a comprehensive knowledge as a layman of diabetes and of course at all diabetics and their caregivers. Now, diabetes as a disease, you must have heard, affects nearly every organ in the body. How does it do that? What's the mystery behind that? It's pretty simple. Diabetes affects the pipeline of the body, that is, the blood vessels that carry blood to all the organs of the body. Hence, it affects every organ in the body. Now, coming to our topic, macrovascular complications. As the name implies, macrovascular means the large vessels of the body. Diabetics, as a rule, have an unusual predisposition to develop narrowing and stiffness of blood vessels, especially the arteries, and this is known as atherosclerosis. Along with that, diabetics also have an unusual predisposition to develop clotting of blood inside those blood vessels itself. Now, this double whammy of atherosclerosis and clotting of blood inside blood vessels can lead to a lot of grave complications that are mainly seen in the heart, the brain and the lower limbs or the feet. Coming first to the heart, and we should, because cardiovascular disease is the main cause of death in diabetics and the risk of MI, or as you know it, heart attack, is fivefold increased in diabetics. So just by virtue of being a diabetic, you are already at high risk of cardiovascular disease. Now, the symptoms of this heart disease could be breathlessness just on walking or climbing stairs, waking up in the middle of the night breathless, unusual fatigue, or a severe chest pain that radiates to your left arm, your jaw or your back. However, the problem with diabetes is that it can cause autonomic neuropathy, because of which you might not even feel a heart attack if you have one. Therefore, it is of extreme importance that you should have an annual review of cardiovascular disease done as a diabetic. The next affected organ that most commonly is affected by diabetes is the brain. If the attack in the brain is complete, we call it a stroke, and if it is incomplete, we call it a transient ischemic attack or TIA. If you suddenly lose consciousness or you suddenly feel a numbness or a paralysis in your arms or legs, it could be an attack of TIA if you recover within 24 hours. And if you do not recover within 24 hours and it goes on for a longer time and you take time to recover, it's called a stroke. The other important organ that I'm going to talk about is the foot or the lower limbs. It's usually ignored comparatively to the heart and brain because people think, well, we'll just lose a limb, we won't lose our life. But it's not true. You can lose your life, and believe me, the loss of limb could be life-shattering as well. Therefore, we need to take care of our feet if we are diabetics. The symptoms of peripheral arterial disease, as we call it, if this disease affects our feet, the symptoms could be cramping pain in your calves or thighs, which comes on walking and resolves on rest. You're also likely to develop infections and ulcer in your feet if you have peripheral arterial disease. Therefore, in such a case, your healthcare provider will educate you on how to take care of your feet, because along with losing your circulation in the feet, you could also be losing your nerve sensation in the feet. And you need to get a few tests done to see how your sensations are, how your circulation is. You need to follow it up with your healthcare provider, because the double whammy of loss of arteries and loss of nerves could result in life-threatening infections of the feet, which would cause sepsis. Now, these are pretty scary complications, but this need not happen, and it will not happen to you if you follow a few basic thumb rules that I'm going to tell you now. The 4 basic thumb rules of avoiding all these complications of diabetes. Let's see. The first one is make sure that your diabetes is under control. You should monitor your sugar levels regularly. You should make sure that your levels are within target range. Your HbA1c should be less than 6.5 ideally, or at least less than 7, or as decided with your healthcare provider. And there are 2 ways of actually controlling sugar. The number one way is lifestyle modification. So you should watch what you eat and walk as many steps as you can. And there is absolutely no replacement to lifestyle modification, which is a lifeline for diabetes. The number two thing is to be very regular with your medication, be it insulin, be it oral drugs, whatever it is, as prescribed by your physician. You have to take your medicines on time and regularly. There is no replacement for that either. As these two things are done, your diabetes will more or less be under control. The second thumb rule is to make sure that your BP is under control. Your blood pressure should be under control. If you're a hypertensive, you should be taking antihypertensive medication. You should be taking less salt and do everything that your healthcare provider or your physician tells you to do. Number three thing is to make sure that your lipid levels and your cholesterol levels are within target range. If you're more than 40 years old, you'll probably be prescribed a statin to keep your lipid levels under control, and if you're less than 40 years, you will be prescribed a statin if it is indicated in you if you have high risk of cardiovascular disease. The fourth thumb rule is to take aspirin to thin out your blood if you prescribed by a physician, which makes you avoid unusual clotting in your blood vessels. So all in all, it can be really simple to keep away those scary complications just by following the basic few thumb rules and by introducing lifestyle changes. Make health a way of life, defeat diabetes. Thank you.